empower communities for better health outcomes. This session will be chaired by respected academician Dr. Ravindra H.N. Sir, Dean, Faculty of Nursing, Parul University, Vadodara. May I respectfully invite Dr. Ravindra H.N. Sir to please come forward and join us on stage. Hello. Everyone, please give a big round of applause to Sir. To lead this important discussion, we have with us a dynamic educator and influential voice in nursing academics, Mr. Kiran Damodia Sir, Principal of TNTV Institute of Nursing, Surat. Sir, we welcome you to the stage.
Sir is Principal of TNTV Institute of Nursing, Surat, bringing over the 34 years of dedicated service to the healthcare and the nursing education. From his early day as a staff nurse to his current leadership role, he has shown the commitment to the patient care, public health and academic excellency. Sir played a vital role during the major crises like a Bhuj earthquake, Surat floods and the COVID-19 pandemic, demonstrating the outstanding crisis management. Sir has led a public health initiative managed by pandemics and the launch in nursing helpline services, making healthcare more accessible in Gujarat. As a former director of Gujarat Nursing Council and editor of the Paricharika Darpan, Sir has shaped nursing policy and the literature. Sir is known for his dedication to the rural and the tribal health. Sir is continued to inspire the next generation to the nurse through his visionary leadership and the impactful work. We are delighted to have you, Sir, with us today as the moderator of this session, and with that, I would like to request Sir to guide us to the session with your expertise.
Good afternoon to all. I would like to introduce Dr. Ravindra H.N. He is an excellent dynamic leader. His extensive qualification and leadership, experience in nursing education and research, with over the 22 years in the field, including the 17 years in the teaching and 4 years in the clinical practices. He brings a wealth of the practice and academic expertise. His academic credentials, including a PhD in nursing, MSc in nursing, MPhil in healthcare management administration, and MA in sociology, demonstrate a strong interdisciplinary foundation. His authorship of the 3 nursing books and over 50 research papers, along with the mentoring of the 8 PhD scholars, highlight his commitment to advancing nursing knowledge. As Dean and Principal at Parul University, he has proven administrative and leadership skill. Future evidenced by his role as an ad hoc inspector of the Indian Nursing Council, Gujarat Nursing Council and University. Board of Studies member at the multiple university within the nation. And chief editor reviewer of the reputed journals. His involvement in curriculum and development, faculty programs and national conference underscore his ability to drive institutional growth and innovation. Dr. Ravindra's comprehensive experience and recognized leadership make him well suited to lead with vision and impact. I would like to continue with Dr. Ravindra sir, please.
Good afternoon, everybody. It is my proud privilege to introduce a great and renowned speaker of today's afternoon. It is Dr. Lakshmi Ranganathan, Associate Professor, Trainer at Oman College of Health Sciences, Oman. Dr. Lakshmi brings with her impressive 33 years of academic experiences with expertise spanning research methodology, community health nursing, and maternal and child health nursing. She holds a PhD in education from Asia E University, Malaysia, along with several international certifications. And she has possessed a global perspective and commitment to lifelong learning. Her contribution to nursing education and research are widely recognized. She is a proud recipient of numerous accolades including Best Faculty Award, Best Researcher Award, and Best Poster Presenter Award at National and International Award. One among it is International Best Researcher Innovation Award in the year 2020. A prolific scholar, Dr. Lakshmi has authored more than 25 peer-reviewed journal articles, contributed a book chapter, and has chaired over 15 workshops and seminars. Her leadership in funded research projects, particularly in the areas such as COVID-19, clinical education, and non-communicable diseases, reflects her dedication to advancing nursing science and public health on a global scale. In addition to her academic and research endeavors, Dr. Lakshmi is actively involved in multiple professional organizations and serves on various education editorial boards, continuing to shape the future of nursing education and research. Please join me in extending a warm welcome to Dr. Lakshmi through online, and she will be taking on the topic that is promoting health literacy to empower communities for better health outcome. Over to Dr. Lakshmi Ranganathan through online.
Okay. So, good afternoon, everybody. I'm so honored to meet all of you on this virtual platform. It's a cherishable moment, actually, to see SOCHNI growing day by day. Yeah. So if I open the slide, it may not move. It may not move. So is it okay? So let me just. Is it okay? Okay. I owe a big thanks to the principal of CVM College and the organizers, teachers, participants. I also take this opportunity to thank Dr. Esther Shirley Daniel for giving me this opportunity. Without further delay, let me move on to my topic. Promoting health literacy to empower communities for better health outcome. So I was just thinking, this is a topic of need of the hour, and then I was so happy and proud that this topic is given to me. I will just tell you the glimpses of what I'm going to go through. Introduction to move on with the WHO's move on health literacy, little bit statistics in India, key challenges, strategies for improvement, and role of community health nurses, what is our role and how we have to go about, and I'll conclude with references. So let's see what is health literacy. It is an ability to access, understand, and use health information effectively. It's a key to make an informed health decisions and healthy living. It also influences personal and community health outcomes. WHO Move On Health Literacy. The World Health Organization developed a toolkit specifically designed for low and middle income countries, including India. Relevance of health literacy to public policy and offer strategies for its integration into health promotion, disease prevention, and service delivery systems. It's valuable guide for the organizations and also the government, and aiming to incorporate health literacy responses into their practice. Let me go through some of the statistics. It's very important. So let us take the general literacy rate in India. As per 2011 census, it's 74.04, and it has been a long time, so I think definitely the literacy rate would have been high in India. This is about general literacy rate. Coming to the health literacy, the various studies, I'll just explain to you when I'm just going one by one. What are all the studies done, where it has been done, what is the exact statistics, and we got it from the authentic resources, especially got it from authentic resources. 27% of the Indian lack adequate health literacy in general. Approximate is Anything? Can you hear me? Okay. Can I go ahead? Okay. Because I can hear a lot of disturbances. Okay. No. Approximately 60% of the rural Indians depend on unqualified practitioners for healthcare, which increases the risk of misdiagnosis and improper treatment. This is a big problem in India, and we have to, when we find out or identify the unqualified practitioner, we are supposed to take a proper action. In an urban slum setting, 76.9, which is literally 77% of hypertensive patients, showed low health literacy, which was associated with poor self-care practices, limited access to primary health care services. As per the National Family Health Survey, around 36% of the women and 29% of the men lack awareness about essential health indices like MCH care, vaccination schedule, and disease prevention strategies. In 2022, increased literacy about diabetes mellitus and hypertension levels reduced hospital readmissions by 25%. A study which is done in India, it's a huge study. Nine studies altogether put, and then they have just taken like a Scopus review. Here, the studies have been done in Jharkhand, Orissa, Delhi, Maharashtra, Karnataka, and UP, and other areas, rural areas also few. Various documents have been compiled on breast cancer awareness, tobacco, chewing, cataract, family welfare, anemia, neonatal mortality, and all that. So coming to the result or recommendation of this study is they strongly recommend there is a need for essential to empower community as the literacy level shows very low. Next, another statistics I found, the National Health Profile 2022 highlights that less than 40% of the population possesses adequate knowledge about preventive health care. Health literacy interventions improved antenatal care attendance by 45% in regions with access to ASHA. ASHA, I will explain to you later, accredited, especially the social activists, health activists. No? I will explain to you ASHA workers little later. Neonatal mortality rates dropped by 10% in districts with active health literacy programs. A study done in South India also reveals the health literacy improved medication adherence among diabetic mellitus by 15%. Only 18% of the Indians are adequately informed about health insurance scheme despite of initiatives of Ayushman Bharat. So, all this survey results or all these statistics show us there is still a need for us to improve the literacy among public, and it is not only in India. Developed countries like even in America, there is a recent statistic shows 9 out of 10 Americans have low literacy about medical issues. So they may have 100% literacy, but as far as the medical literacy is concerned, so the recent statistic shows 9 out of 10 has a limited literacy, especially medical literacy. So it's not only developing country or underdeveloped country or a developed nation, it's a question of what about the health literacy? Are our people aware? After COVID, I can say to some extent, people started getting to know about the health issues. However, all of us are cautious about our health issues and health, especially to maintain our health. However, the situation, poverty, illiteracy, many other factors which is hindering us actually to go in for health literacy. So it is not only to know about literacy, what about the medical people? How many of us are going for regular exercise? How many of you above 40 is gone for one master health checkup? How many of us are checking our BP or weight every month? So these are all, even though we are in the medical field, we are in the nursing field, we are not doing. So it's not only awareness, it's the purpose of practicing. So it is not only just to know about all this. We have to make sure that the people practice and then for promoting health. Coming back to the slides of national survey again, It is exhibited that the individuals with adequate health literacy had higher incidence of chronic conditions, including diabetes, compared to those with adequate health literacy. Low literacy. What happened to low literacy? When you have a low literacy, the health-seeking behavior will be delayed. Prevention and management, especially of the disease condition, will be again further delayed, and diagnosis will be delayed. Poor treatment adherences may result. There may be going to the emergency room will be increasing. Mortality rate might be increasing. So all this could be one of the reasons, some of the reasons for low literacy. So improving the literacy is also one of the important part all of us as a community health nurses. Cultural and linguistic and educational barrier also one of the reasons why it persists. Why it matters, why we should bother about health literacy. It reduces the disease burden and healthcare cost. You know, the government of India is spending around 3.6% of the total budget for food. You know, other means of marketing and other, it is income and expenses both. But as far as the healthcare is concerned, for the government, income it is not an income generating source. So healthcare cost is really a major burden for the country as such. To enhance the patient engagement and the treatment adherence. Again, this is also one of the important that we have to really bother and boost health literacy. Promote healthier behavior and outcomes. Improved literacy is equal to early diagnosis and better management. All of you know prevention is better than cure, and what is the purpose of 5 levels of prevention? Early diagnosis, specific protection, health promotion and all. Key challenges. What are the important key challenges that we have right now? At present, low literacy level in the rural underserved area is educational disparity, as I explained before. Next one is cultural and language diversity. In the cultural language diversity across the states, especially if it is tailoring the health literacy and prevention. Coming to the cultural factors. See, in India, we can take the cultural factor into 3 patterns. One is culture, which is improving the health. The cultural practices which is affecting health. Cultural practices which doesn't have any influence on health. For example, practices like not giving feeding colostrum or giving castor oil to the baby as soon as the child was born. These were all the cultural practices which is going to affect the health. So we have to really discourage these. Cultural practices enhance, like for example, so many things about our balanced diet, importance of food, importance of festivals and then food. These kind of cultural beliefs that we have to really encourage, because it is going to really boost the health avenues. And coming to cultural practice which doesn't give any influence, for example, tying the black thread around the hand or going for something prayer, special prayer with that, it is not going to affect the health. We will not touch on those grounds. So the cultural factors which is boosting the health, we have to really boost, and then that is going to be a pride for India as well. Because before all this literatures, all this medical field which has been boosting like now, before that itself, we were really advanced in so many technology, and we know about Shishrata Saraka Samhita 2000 years ago. The surgery was done in India, plastic surgery has been done in India. So it is not that we are unaware. We were aware right from the beginning, and we are having one of the very strong history background, and then we cannot put down our cultural beliefs as well. Coming to the key challenges, widespread misinformation about myth or superstitious beliefs, of course, maybe by social media or by word of mouth. Yes, as I said, when it is hindering the health, we have to discourage. Limited access to reliable digital health tools, infrastructure gaps. Rural areas still lack basic health infrastructure. Resistance to change. Sometimes it is difficult for us to change culturally. So again, it will come through like in times when the time only has to answer that. Like for example, I can tell 25 years, 30 years ago, vaccination was one of the big issues. The children were not taken for vaccination. The health workers were beaten, pelted with stone when they go for vaccination. But now the people coming voluntarily for vaccination, they knew the importance. This is because of health literacy. Similarly, all kind of, myths will go away, once we start giving health literacy, slowly empowering the people who are already there in the community. Funding constraint, of course, it's another big problem in large scale, especially when you are planning to do some health infrastructure. On a large scale, it will be a big constraint. Okay, what are the strategies to improve health literacy? Train ASHA workers and local healthcare workers. So these ASHA workers can be helped in especially training DIEs in remote areas, especially what is it called as tribal areas, very tribal area. Although we promote the institutional deliveries and the basic sanitation, replacing the toilet, and then healthcare, family and reproductive health, all that could be one of the agendas for ASHA workers. Again, I'm going to explain to you about ASHA a little bit in the later slides. Utilizing the visualized spoke media, local languages, so school health-based program, educational programs, community workshops and group counseling, innovative approaches to health education, and sustained community engagement also enhance the literacy. Next is, now we are in a digital era and India is booming in digital marketing. Ayushman Bharat Digital Mission is one of the important things I would like to quote here. This aims at mainly integrating the digital health infrastructure of the country. And mobile health, young health is very, very important nowadays as far as India is concerned, because I can just tell many mobile apps, like for example, identification of cardiac problems, CA breast, or CA cancer reduction equipments, all it is there in mobile app. And also I would like to say, like peers form, that is peers is like identification of pre-eclamptic toxemia in women. All the health workers, the village health workers are given the mobile phone and mobile apps just to identify or detect the pre-eclamptic problems in India. I think someone has kept the phone nearby. It's why echoing. Can you just keep the mobile or any electronic equipments away from the presentation area? Thank you. So the mobile apps is one of the important things nowadays. The health workers are given, the village health workers, especially social sector health nurses have been given, or block development people, Anganwadi workers, all these people are given mobile health apps, especially for the health worker for creating an awareness. So this will help easy detecting the risks of the especially mothers or elderly people, or identifying diabetes and so many other things. Telemedicine for remote access and guidance. As we had a COVID pandemic, and most of the all over India, I can say, we were using the telemedicine, and people know much about telemedicine. It's not new concept. Coming to the collaborative effect, what the government should do: integrate the national health policies, public health missions and programs, integrate health literacy into national curriculum. NGOs, the non-government organization, has a very big role to play to reach the grassroots level as far as the health campaign is concerned. Media, mass media, public awareness through radio, TV, social medias also is one of the collaborative effort to improve the health literacy. Private sector, health technical innovation, capacity building, it's very important. Capacity building for frontline workers, and develop culturally sensitive material, multi-stakeholder collaboration with government, NGOs and local leaders, strengthen the community-based health infrastructure, promote accountability through monitoring, all could be the collaborative efforts. And we are going to the very important move, that is the role of community health nurse in promoting health literacy. So having said the key challenges, having seen the collaborative efforts, what are we going to do? How are we going to be taking a role or being a part of raising the health awareness? Simply, first one is, I have just divided the role into 5 concepts. First one is health education awareness. Creating health education is one of the important pivotal role for the community health nurse. Simplifying complex information, and especially the health medical terminologies, jargons and all, making to simplify steps, and language is very important. Whenever you go to whichever state, whichever language they speak in their language is one of the important success for health education. Make it accessible, understandable for individuals with variety of varying literacy levels. Next one is utilizing visual aids. Employ visual aids such as charts, poster demonstrations, mobile apps, or you can use even the videos. Everyone has mobile nowadays, so you can utilize the mobile these days, which is one of the important media for us to raise an awareness. Group discussion can be done, role play can be done, storytelling. Of course, we will not forget our old method also. Through this, we can educate the community. Health education in schools by using local language, public campaigns, and mobile apps. Digital health platforms, as I already told, leveraging this technology to provide accessible and reliable health information in underdeserved areas, especially Bharat digital mission. Second, after seeing the health education, the second concept is going to be, second big role is community engagement in empowerment. Building trusting relationship by establishing the trust within the communities, nurse empower the individual to take active roles in health decision. They organize a group discussion of workshops to address the community specific health concern, promoting collective learning. Promote collective learning, empowerment and the behavioral change. Community health nurse also act as a change agent by empowering individuals to take the control of their health. So the ASHA, which is let me just tell you the full form of ASHA. It is the active, just give me a minute, I'm sorry. Okay, so the self-help group, community group, selection of process, the Anganwadi worker, BDO, block development worker, building training, help them in helping them in the reproductive health, basic sanitation. All this could be one of the important work of the ASHA. The ASHA is the accredited social health activist. I'm sorry for this abbreviations, because right now I don't have touch really with India, but I always try to update myself. So that's why I'm not, maybe you are very well versed than me about ASHA and all, but just maybe it is new for us, new concept for us, as we lost touch from India for so long years. Third important community health nurses role is chronic disease management. The CHNs are pivotal in managing chronic illness such as diabetes, hypertension and cardiovascular disease. These provide preventive care, early detection, patient education and continuity of care, collaborating with multidisciplinary teams to improve health outcome and reduce the healthcare cost. Next one is the scoping review, as shown various community-based interventions that improve the health literacy among the Indians. So these includes the traditional method, art-based approaches, interactive learning, technology-based initiatives involving health workers in designing, implementing these interventions. It was crucial for their success. The fourth important role of training the community health worker is, community health nurse is training the local health worker. Community health nurses train the local health workers, including accredited social health activists, to disseminate health information effectively within the communities by using the local language. As of June 2022, there are 10.52 lakh ASHAs are there all over India. Developing education material, as I said already, they collaborate in creative, culturally appropriate, linguistic, relevant education material to ensure the effective communication. And fifth role and final role of community health nurse is monitoring and evaluation. So it's not enough that if she goes and leaves some programs or just say empower the community and come up. She also has to monitor and evaluate how is the program taken up or reached the objective, and so on. Assessing health literacy level, nurses assesses the health literacy level of individuals and communities to tailor intervention accordingly. Evaluate intervention outcome, they monitor, evaluate and effectiveness of the health literacy interventions to continuous monitoring or improvement. So to conclude, health literacy is essential for preventive and participatory healthcare. Empowering communities will bring better outcomes. Community health nurses are pivotal in promoting health literacy in India, a key step toward achieving universal health coverage and SDG, that is Sustainable Developmental Goals, 3 by 2030. So the takeaways, is the only constant feature in this world is change. While all change may not lead to progress, but there can be no progress without change. So invest today for healthier tomorrow. So change, don't take chance. So these are all my references. And thank you so much. And it's open for discussion.
Thank you,
The
Dr.
floor is
Lakshmi.
open for discussion.
Dr. Lakshmi has stressed on the requirement of health awareness,
Yes.
health awareness in India with the help of a certain study. She has taken the quote of WHO and also some of the studies based on the National Health Profile and few more
I couldn't hear.
researchers. And also she stressed that the requirement of enhancing Ayushman Bharat, so which empowers the health in India. So I want to give a small incident here about the creation of awareness amongst the people. A patient comes to a poor, middle-aged patient comes to the hospital in the morning, 10 o'clock, comes to the hospital. Meets the physician and consults for his problem. And doctors give him the suggestion to take the medicine in the morning, afternoon and night, 3 times a day. And he goes to the home and attends clinic again on the next day, seeing complaints are exaggerated. So instead of declining, and doctor asks, what has he taken? So he has said, not taken any medicine. He asked why. So he said, you said to take in the morning, afternoon and night. I was waiting for the series to occur. So when I go home, it was afternoon. I thought of starting from tomorrow morning onwards. So it requires, it may be looking like hilarious, but it is a fact. So it happens because, as Dr. Lakshmi said, the requirement of the awareness is much more higher. So especially that non-communicable diseases are more prevalent in educated society. And why to take such examples? Amongst all females, especially amongst the nursing students. So if you survey, 75% of the students, girls, are having anemia. Even that preventive measures. So with this, I think Dr. Lakshmi has given very proper explanation on the given topic. So you hope you have gained the knowledge. So if you have any questions amongst you, you can put up now. If there are no more questions, then we can conclude the session. Thank you, Dr. Lakshmi.
Thank you very much. I really appreciate. Jai Hind to everybody. Bye-bye. If you want me to stay back, I can stay back. The organizers can tell.
Yeah, let us find out.
If there are no questions, then I can exit. Thank you very much once again, everybody. All the best for future events.
Thank you, ma'am. Now comes a very special moment where we express our heartfelt gratitude. A heartfelt thank you to our esteemed speaker, Dr. Lakshmi Ranganathan ma'am, for sharing her insightful thoughts and experiences with such clarity and passion. Your words have truly enriched this session. We are deeply thankful to Dr. Ravindra H.N. sir for his valuable presence and thoughtful guidance throughout the session. Your leadership truly elevated today's discussion. Thank you, sir. For that, I request Mr. Kiran Damodia sir to now felicitate to sir as a mark of our sincere appreciation with memento and certificate. Thank you, sir. A special thank you to Mr. Kiran Damodia, sir, for leading this session so smoothly and ensuring meaningful engagement throughout. Your efforts are truly appreciated, sir. For that, I invite Ms. Indravati Rao, ma'am, Principal of Government College of Nursing, Surat, to kindly felicitate Mr. Kiran Damodia, sir, with a token of appreciation with memento and certificate.
Ma'am, please stay on the stage. As it is a moment of great pride and honor for us that with us we have a highly respected personality from the Gujarat Nursing Council, our esteemed observer, Ms. Indravati Rao ma'am, and to honor her esteemed presence, I now humbly invite respected Principal, Professor Sidram sir, to kindly forward and stage to the honor of felicitating the Ms. Indravati Rao ma'am as a token of our appreciation.
Thank you, sir.